Allergy and Asthma Network works hard to ensure that the patient voice is heard in every discussion. Allergy and Asthma Network is a grassroots organization that has been making a difference in the lives of patients living with allergy, asthma, and related condition for the last 35 plus years. My name is Tonya Winders, and I am the President and CEO of Allergy and Asthma Network, as well as the current President of the Global Allergy and Airways Patient Platform, a global umbrella organization comprised of over 60 patient advocacy groups like Allergy and Asthma Network. Before coming to the network, I had about 17 years experience in leadership roles within the allergy and asthma industry. And I'm a proud graduate of Louisiana State University, where I earned my master's in business administration. The joy of my job really is connecting with people on a national and international level to spread awareness and preparedness messages. I enjoy doing this by interacting with patients, families, and caregivers, as well as working with leading experts to build patient-centered collaborative care teams to achieve optimal health outcomes. But this work is very personal to me as well. For many of you, you may know, I am the mother of 5 teenagers and young adults, 4 of whom live with allergies, asthma, and atopic eczema. But the truth is, I don't do this work alone. We have a wonderful team at the network, and I am so pleased to have some of our leadership team here with me today. During today's webinar, you will hear from Linda Mitchell, our Chief Operating Officer, Sally Schessler, our Director of Education, Charmaine Anderson, our Director of Advocacy, and our new Director of Research and Evaluation, Dee Dee Gardner. Our time together will be spent highlighting the network mission, history, and mission areas. We'll also talk about 2021 initiatives and how we plan to turn the corner into the new year of 2022, as well as highlight some of the resources that we have available free of charge for you to access. This is the full team of the network, and you can see that we did have the opportunity actually back in August to gather together for the first time in about a year and a half, given the pandemic. And this is a casual photo outside of our offices in Vienna, Virginia. So the network mission, I always like to say it's great to start with the why behind the what. So why do we do what we do? The mission of Allergy and Asthma Network is to end needless death and suffering due to asthma, allergies, and related conditions. We do that through our 4 mission areas of outreach, education, advocacy, and research, which you'll learn much more about today. Our mission has remained the same for the past 36 years. In November, we will celebrate our 37th anniversary and start into that 37th year. And we are so excited about the continuation of the work that began in 1985 by Nancy Sander. The truth is, we have a strong belief system that it's our privilege to work each day to ensure that patients and people have quality and accessible asthma and allergy care for all people in all neighborhoods. Every single person matters. And zip code truly should not be the determining factor in the degree or level of healthcare that you have access to. So what about our history? You never know where you're going unless you know where you've been, what someone once said. And so as we take a look back, it all began in 1985. Nancy Sander was the mother of a daughter with pediatric asthma and severe food allergies. She established the nonprofit Mothers of Asthmatics and actually published her first Mothers of Asthmatics MA report sitting at her kitchen table with an old-fashioned typewriter. Now, I don't know about you, but for my kids, that seems like it was, hundreds of years ago, but it actually was only 36 years ago when Nancy first did that. What happened there is that newsletter actually garnered some national media attention. And ultimately, Nancy was invited to become the founding member of the National Institute of Health Coordinating Committee to help develop the asthma guidelines in 1989 to 1992. This really gave way to the growth of Mothers of Asthmatics and to ultimately the change of the organization to become more focused on allergy and asthma. So in 1993, Nancy led the organization to rebrand to become Allergy and Asthma Network, Mothers of Asthmatics, a national network of community volunteers. Throughout the 90s, the focus of the organization was on advocacy and education primarily. And so some of the advocacy efforts is that in 94 and 95, the organization led a stakeholder group to ban ozone depleting CFC propellants and to get us to the point of having HFA inhalers as we do today. We also spoke out against an FDA proposal to make asthma medications over the counter without a prescription, helping to make the case that asthma should be rooted in an ongoing relationship with your doctor and the patient. In 1998, ANMA responded to the dramatic increase in asthma prevalence and deaths with the first Asthma Awareness Day on Capitol Hill. And of course, this has become a beloved event that draws hundreds of advocates each and every year to charge Capitol Hill and to have conversations with our policymakers about issues facing families that we represent. In 2002, AMA was the first organization to really launch a dedicated Hispanic outreach. And this was included a Spanish language helpline, as well as a series of publications devoted to supporting the Hispanic community. As we moved throughout the 2000s, the work with Congress really turned toward what is called the Asthma Act. This is an act that actually allows students the right in all 50 states to carry and use their emergency medication. That work began in 2003, and actually the law was signed into action in 2004. And then in 2010, ANMA began to work with Congress to really establish the first Congressional Allergy and Asthma Caucus. And that is a core group of policymakers that reside in the House of Representatives and really is our go-to group when we have issues that are facing our families and we need that federal activism. And the truth is, throughout this entire time, for these first 25 years of the organization, the mission stayed the same: driving awareness through outreach, educating patients, families, caregivers, and healthcare providers, and then advocating on behalf of the community with this work at the federal and state policy level, as well as then moving forward into the payer policy world, which we'll speak more about. Now, in 2011 to 2013, once again, ANMA was offered the opportunity to be a part of the national guidelines, this time in the management of food allergies in the US. In 2013, another important milestone was when the School Access to Emergency Epinephrine was signed into law, which actually allows schools to stock emergency medication and administer that many times under the Good Samaritan legislation that exists throughout states. It was also in 2013 when the founder, Nancy Sander, decided to retire after 28 years of leadership of the organization. And Nancy and the board appointed me as the president and CEO. It was also the time that we decided in early 2014 to just become known as Allergy and Asthma Network, to be more encompassing and representative of our full community rather than just Mothers of Asthmatics. In 2015, we really focused on sharing medical innovations and the best practices throughout this space of allergy and asthma. And it was the first year that we were able to host the US Asthma Summit. This event has now grown to over 800 participants every year, gathering around the virtual and in-person live table when able to talk about the latest hot topics in asthma, and how we can work collaboratively as a community to advance asthma care in our country. In 2018, there was a landmark lawsuit that actually Allergy and Asthma Network prevailed in, where a jury rejected a $224 million suit against the network for speaking out against fraud and deception in allergy testing and allergen immunotherapy. Subsequently, over the last 3 years, we have won all appeals and have certainly declared full victory in this fight against United Allergy Services. In 2018 and 19, the network began to partner with our Not One More Life program and the Severe Asthma Foundation. Those two 501c3s came under our umbrella of the network and became programs and emphasis of our education efforts. We also partnered with organizations and professional medical societies like the American College of Allergy, Asthma, and Immunology and CHEST to create shared decision-making tools in areas like severe asthma, atopic dermatitis, and are currently in the process of launching a shared decision-making tool as well in chronic urticaria. We also have this in allergen immunotherapy and food allergy. So since 2020, the work of the network has continued, and I have been honored with the privilege of serving as the first patient advocate member on GINA, and also, as mentioned earlier, have served as the president of the Global Allergy Airways Patient Platform, which provides the network and myself the opportunity to have a greater international voice in moving the patient voice forward. It also has afforded us the opportunity to be published in over 50 peer-reviewed manuscripts over the last several years. So now I am so pleased to turn it over to our mission area directors and Linda Mitchell, our Chief Operations Officer, to share a little bit more about how we work in each of the 4 mission areas. Linda? I'm sorry, Sally's first.
That's okay. I was going to go first either way. Well, at the network, we value education for both patients and for healthcare professionals. As Tonya said, I'm Sally Schessler, and as Director of Education, I believe that when we understand our health concerns, that we're able to make positive choices to improve our health and live fully. Well, we offer educational resources in a variety of formats. And while we've historically provided much of our information in the printed word, we're moving more and more towards digital resources in all aspects of our work. One way we provide our guidelines-based information is through webinars. We have 3 different webinar series that each provide unique information. Our Advances in Allergy and Asthma series is co-sponsored by the American College of Allergy, Asthma, and Immunology. And while the topics appeal to both patients and providers, this series has definitely more of a medical approach. We do offer continuing education for healthcare providers through this series. Since March of 2020, we've presented 30 COVID-19 webinars with medical experts from across the country. I remember as we started to develop this series, we said, I think this is going to be big. And I think that was very right. We'll continue to do these webinars until the pandemic is behind us. We also do a wide range of topics in our network webinar series. These are very patient-focused and touch on topics that include asthma, allergies, atopic dermatitis, school, and a lot more. As you can see from the chart on the right side of the slide, we've had a lot of webinar views, but especially in 2020. We found that as people were working from home, that webinars became a vital way to receive information and education, and we doubled our efforts to make sure that we could meet those needs. On the next slide, you'll see we have another resource for you, and that's our patient learning pathways. These short video presentations are written with reading level in mind and provide basic health information for patients. If you're looking for basic information on asthma, allergies, COPD, or any of the topics you see here, you can take a few minutes to learn about these health conditions. And if you're a provider, these would be great tools for you to use with your patients to help them understand the basics and help supplement your patient education efforts. We also offer a community asthma and COPD experts program where health professionals volunteer their time and expertise to raise awareness of COPD and asthma care, as well as provide education at a variety of health literacy levels. We currently have 101 volunteers from 26 states and Puerto Rico. We provide monthly e-newsletters and meetings, and a great benefit of this program is that we support our volunteers in pursuing asthma educator certification. We provide education, and the National Asthma Educator Certification Board offers discounts on the certification exam. I only have time to scratch the surface on our education offerings today. We have so much more to offer you and so much more we could talk about. We could do a whole webinar just on our education. So the question comes, how can you partner with the network? Well, if you're a health professional, you can join our Community Asthma and COPD Expert Program. Look on our webpage under About Us and then go to Get Involved and then Volunteer. And you can find the way to sign up. If you're a patient or provider, you can find our free webinars at the bottom of our homepage. Join us for upcoming webinars or listen to recorded ones. You can use our resources and attend our programs. Our programs are both virtual, and more will be getting back to in-person events. And feel free to email me and let me know what you need. You're important to us, and we're here to help. At this time, I'd like to send it over to Charmaine Anderson, our Director of Advocacy.
Thank you, Sally. Pleasure to be with you all. The network's advocacy function is critical to our mission as we raise awareness and educate policymakers about the importance of smart and effective policies and programs to support the millions of Americans living with these chronic conditions. And I'll say on a personal note, I use this kind of position not only in practice to represent our patients, but also it's a personal mission for me as one who's been living with asthma my entire life, along with 3 of my children who also suffer from asthma as well as food allergies. Each year, the network, we actively engage at the state and federal levels of government to advocate for key policy priorities, which include those listed here on the slide. Access to care and affordable medications and treatments with an emphasis on health equity, asthma and allergy federal program funding, reducing health risk for allergy and asthma emergencies, mitigating environmental health hazards, and COVID-19 prevention and treatment. Within our key policy priorities are issues we monitor and weigh in on by writing letters, sending emails, making phone calls, and meeting with legislators in person, which is one of the most impactful ways we advocate in order to share personal stories and share why certain legislation matters to patients and their families. Having that patient's voice is an important aspect of our advocacy work. Our patient advocates play a crucial role in raising awareness, educating policymakers and the general public. And just for notation, we currently advocate, or at least have advocates who help us advocate, in 40 of the 50 states. And just up until this point, we've even had 17 laws in 12 states passed thus far. So we're excited about just the movement and the progress that we're doing and having at the state level, as well as at the federal level. And I'll add, we support our advocates by providing resources to assist them in making those phone calls, writing letters, sending emails, posting on social media, and participating in person meetings with their legislators. We also have grassroots campaigns that are utilized to mobilize our communities in the states with active legislation around those policies to contact their legislators about a specific issue from time to time. And each May, our signature event, where we bring patients, families, medical professionals, industry leaders, and researchers from across the country to participate in our Allergy and Asthma Day, Capitol Hill, otherwise known as AADCH. There we are able to discuss critical legislative and regulatory issues facing patients with asthma, allergies, and related conditions, This past year, it was not in person. However, we had a very, very successful event virtually, where we were able to meet with legislators via Zoom and other methods. And we had close to 300 participants in 30 states. And in the year prior, when we have had in-person events, we've reached upwards of 200 participants. So we look to engage with members of Congress, hopefully in person in 2022. And I'll speak more about that a little bit in my presentation here. But these meetings are scheduled for participants with their House and Senate members in Congress and their staff. And we also make arrangements for those who would prefer to send letters or emails, make phone calls to congressional offices, and post on social media. Our next AADCH event is planned for May 3rd and 4th in 2022 in person. So we invite you to join us. So please check our website in the coming months for more details. And to support our efforts, we encourage you to complete our survey, also found on our website, which allows us to gain insight into who you are, what issues matter most to you, and ways you would like to advocate. When you provide your information through the survey, we will follow up to keep you updated on active legislation that affects you in ways you can get involved through our action alerts. We know that when we work together, we form a strong collective voice to inform and influence public policy that supports all Americans living with asthma, allergies, and related conditions. Now I will turn it over to Dee Dee Gardner, our Director of Research and Evaluation. Thanks.
Thanks, Charmaine. I'm excited to be here. My name is Dee Dee Gardner. We are going to be talking about the AAN's mission that is associated with research. And our research mission focuses on ensuring that patients do have a voice, as Tonya had said earlier. We want to ensure that the patient's voice is heard in all aspects of research or studies. The outcomes of research inform all of us about trends, risk factors, treatment success, and patterns of care, and even costs associated with that care. Outcomes of research and studies impact all of us. The AAN collaborates with researchers and patients who are involved in different types of studies, investigating different types of perceptions, cares of treatment, and new medications or technologies. To advance our research, we focus on 3 pillars that you see here. First, the clinical and translational research includes informing patients about studies that they can take place in that might be in a clinical setting or a home setting, using interventions or treatments such as monitoring devices, testing the effectiveness of these treatments. One of the most important types of research is the translational research. This is where we as AAN share the discoveries and the outcomes of these trials into the real world and making actions to adopt best practices in our communities. AAN shares the results with our patients and their caregivers through different mediums that Linda will talk about, such as infographics, articles and webinars, peer-reviewed journals. This is one way to empower our patients and their caregivers to use this real-world evidence to make shared decisions with their healthcare providers. Second, we ensure that communities of interest are well represented by inviting a diverse population to participate and decrease disparities of unrepresented minorities by making access to all studies equitable. We make intentional efforts to invite patients and caregivers from all walks of life to share their questions that are specific to their communities to be answered through our research efforts. We bring the researchers and the patients together in a unique space for collaboration, which makes these outcomes much richer. Furthermore, we are intentional about inviting the right patient community to consider being involved in a study at a time that makes sense to them. We support that community or individual through their participation journey in the research. Now on the next slide, you will see more detailed methods used when we invite patients to share their voice. Here you can see that we keep our patient's voice heard at all stages of a research study, from the beginning to the end. This means that patients get an opportunity to share their voice when we are thinking about ideas or an inception of a research question. We want to ensure that patients get to inform promotional materials, making sure those materials are very clear to a patient, that the pictures make sense, agreements to participate are clear and understandable, because otherwise patients may not participate. We need to include all people and walks of life in all parts of the study. One of the opportunities for people to plug in is focus groups or surveys, as you see here. We also encourage patients to participate in clinical trials as a patient who evaluates, as I had said before, rather that be a medication, a technology, or even in regards to how these results are translated and shared and disseminated with others. We want to ensure that patients get the opportunity to share their voice and be the thread from the beginning of the project to the close of the project. Furthermore, when we move to the next slide, I would like to share some information about a current project that we are working on. We're currently enrolling patients in our Not One More Life Trusted Messengers Telehealth Asthma Coaches program. Telehealth is a virtual way to meet with your healthcare provider using either your cell phone, a computer, or a tablet. Some patients actually in the study may qualify to receive a tablet. This program is focused on high-risk respiratory patients to increase access and decrease inequities for all patients. The goal here is to increase asthma self-management skills over about 6 weeks period of time. During that 6-week time, the patient would meet with an asthma coach via their computer platform for about 45 to 50 minutes. And the patient would also use an app on their cell phone to monitor their symptoms of asthma or symptoms of respiratory disease, when they use their medications, and their respiratory status. We invite you to look at the website about the Trusted Messengers program. I'd also like to share information about the patient-centered outcomes projects that we have. The Allergy Asthma Network has received about $250,000 for 2 one-year patient engagement awards from the Patient-Centered Outcomes Institute, which is considered PCORI. These awards have opened the door for patients to share their perceptions and to ask important questions associated with their own communities to the researchers. This has been a safe space for all of these patients. The most current patient engagement award that we have currently, as you can see on the picture here, is the Unidos Hablemos Day, or the United Let's Talk About Asthma and COVID-19 on October 7th at 4:30 Eastern Time. This engagement award includes a patient advisory group who has led the development of 6 monthly sessions that will be virtual webinars similar to this one, offered in Spanish and English, where we will host asthma and COVID experts, as well as patients who will share their stories living with asthma and surviving COVID. I would hope that you can join us. How can you get involved? What we would like to do is, again, this has been a very short snapshot of what the research mission is here with AAN. We have several ways for you to become involved. The first is through the asthma registry, the Asthma 360 registry. This is where we can bring together patients diagnosed with asthma who are willing to share their information about living with asthma over time in an online platform to help Allergy Asthma Network have a deeper understanding of your asthma. This registry collects information around asthma and is used to see trends associated with this disease, treatments used, and information about studies that can be shared. Furthermore, this registry will support future treatments and asthma care. Another way that you can get involved is if you are an adult suffering from asthma and would like to learn more about the Not One More Life Trusted Messenger Telehealth Asthma Coaches program, please contact me at the address below. Third, I would like also to invite you to consider becoming a patient research advisor to provide your perceptions associated with any study question, the design process, materials and documents, participate in focus groups, and to speak to us about any type of research question you have. We want to ensure that we can share the results and outcomes that are meaningful to you and your patient community. That may mean that the resources need to be translated into a specific language, such as Spanish. Take some time to look at our research website. It has plenty of information about different studies we are involved in, and there's a special place for you if you would like to become a patient research advisor as a first step. Please reach out to me. Thank you. I'd like to introduce you to Linda Mitchell, our Chief Operating Officer.
Thank you, Dee Dee. I'm Linda Mitchell. I'm Chief Operations Officer for the Allergy and Asthma Network, and I'm really excited to be here to talk to you about our digital outreach. In my role, I work on the day-to-day operations for the organization, but I also lead the digital health communications team here at the network. Our collective team role is to take the work of the 4 mission areas, outreach, education, advocacy, and research, and amplify it through our digital channels. Those digital channels include our website, our e-newsletters, our social media channels, and others. We take traditional resources like print and infographics, and we convert them into something shareable on digital channels. That's just one example of what we do. We also tailor the content to our 2 main constituencies, which is healthcare professionals and patients and families. At the heart of our work, though, is the patient always. Our website is our main hub for just about everything. There you can access our educational content for patients and healthcare professionals that Sally has developed with her dedicated work. You can visit our online store for print and digital resources, many of which are free or at nominal cost for both patients and healthcare professionals. Our respiratory treatments poster, for example, is our most popular offering, but our understanding guides, which are patient resources, are equally popular as well. And there's many more. There's more than 60 items in our online store. You can also connect with us via our email newsletters. We offer 2 e-newsletters, our monthly e-newsletter, one just went out today, and our bi-weekly Get Involved in Research newsletter that supports the work of the research group. And there you can find opportunities to get involved with surveys, clinical trials, or patient engagement events about research. Our social media channels are active daily. We share educational information, infographics, event announcement, research opportunities, and more. Our main channels are Facebook, Twitter, Instagram, and LinkedIn. You may have found them and come to us to register for this webinar from there. We also have many videos on YouTube. We record all the webinars and host them on YouTube. We have Ask the Allergist monthly recorded videos, which are really informative for patients. And we have lots more of recorded sessions on various topics. You can sign up for our flagship or special events on our website as well. Our fall events include our US Asthma Summit that Charmaine already mentioned. That's being offered both in person at the college meeting in November, but it's also going to be live streamed, so you can attend virtually. We also have our new Unidos Hablemos virtual conference series that Dee Dee was talking about, which is a conversation with the Hispanic and Latinx community to understand their needs regarding asthma and COVID-19. In the spring, we will offer our Allergy and Asthma Day on Capitol Hill that Charmaine talked about. That's an event we've been offering for more than 30 years. And we just finished up a 3-day virtual Global Food Allergy Summit last month. There's always something going on, and events are a big part of the network's work. Some of the new initiatives that we've worked on this year, it's been a really busy year, include the launches of 3 new microsites. Trustedmessengers.org, Dee Dee mentioned, which is our work in local communities of color offering free lung screenings, COVID testing, COVID vaccines, and the telehealth coaching program that was discussed. Our eosasthma.org website is our new website offering information about eosinophilic asthma, a particularly severe form of asthma. Our 3rd new website, we just launched it last week, so the image on this slide is a little out of date. eczemainSkinOfColor.org is another health equity project that we just completed to address the need for better identification and quicker diagnosis for people of color who have asthma. 2 additional projects we're working on this year, and we have worked on rather, are the launch of our hub of resource for asthma educators and state asthma control programs. That hub is a growing body of resources that support the CDC exhale strategies. We're building a database that will be adding to over the 5 years of the project. And all of those resources align with those exhale strategies. And the goal of the exhale strategies is to reduce hospitalization and deaths due to asthma. So it's a really important project we're really excited to be involved in. Lastly, we launched our asthma and allergy forecasting tool. It's a cool web-based app and you enter your zip code and the date you want to know the information for, and it can project up to a year in advance what the allergy and asthma and flu index is for your area, so you can see about taking those into account when you're doing your planning. You can find that at allergyasthmanetwork.org/weather. So in conclusion, how can you get involved? We have a lot of online ways where you can get involved. You can see here, you can share your story. A story can be shared for educational purposes, support for other community people who just want to hear from others who, like them, who have the same condition or same struggles. We also collect stories so that we can use them to advocate for better policy and law changes to support the asthma and allergy community. You can share our content on social media. We have a lot of things that we share that we'd love for you to share on your own social channels. You can volunteer with us, as was mentioned. You can donate or fundraise for us. We have Facebook fundraisers going on regularly from supporters who have birthday fundraisers or whatever. Your gifts will be used to continue the work we do to reduce needless death and suffering due to asthma, allergies, and related conditions. Thank you for listening, and now I'm going to turn it back over to Sally, I believe.
Actually, I think it's coming back to me. So this is Tonya, and I want to thank everybody again for just the high-level overview of their individual mission areas. As you can see, outreach is all about driving awareness of the diseases that we represent. Education is about providing patient-friendly resources for patients, family members, caregivers, as well as healthcare provider education and policymaker education. And that leads us to our advocacy mission area, which really is about driving change to ensure we get the right treatment to the right patient at the right time with the fewest barriers in place at the state and federal level. And then finally, the research mission area, which I think Dee Dee did a wonderful job of highlighting all of the various projects, or many of the various projects, and the key elements of ensuring the patient voice is at the forefront and at the center of every stage of clinical trials and real-world translational research. So when you think about Allergy and Asthma Network, many times people think about Allergy and Asthma Today magazine. That is a print publication that was in doctors' offices up until the pandemic. And now, again, we offer all of these digital resources free for download on our website. And so, as Linda said, we have over 60 items from our understanding guides to allergy-safe dining to how climate impacts asthma, resources in both English and Spanish, and we also have a very robust COVID-19 information center. So all of these publications can be downloaded for free at our store. We talked about our poster series. Our most popular poster, Respiratory Inhalers at a Glance. This poster is used by millions across the country in state health departments, in physician offices, in asthma screenings throughout the country. And this is a great tool that shows all of the inhalers that even a child as young as 3 or 4 can point and tell you which one they're using. So it's a really helpful tool and resource that, again, has been used millions of times even over the last year. We have anaphylaxis at a glance, epinephrine treatments, respiratory tools, many different posters, again, that are available for you to access. And then the digital downloads, as I spoke about. So you can order the print resources. Many of those are still in print and available, and we'll ship them out to you for shipping and handling cost only. But then you also can download free copies online. Now, I spoke about our COVID-19 Information Center. We do have a number of COVID-19 resources, infographics, and downloads, as you can see here as well. And we have been on the forefront of really reinforcing, number one, good infection control measures. The 3 W's of washing your hands, watching your distance, and wearing a mask are messages that we've carried forth in every aspect of our work with COVID-19. But then we delved into even further detail around topics like asthma and COVID-19, care paths for school nurses, and also provided resources in Spanish. So there are many, many infographics. And again, if you're looking for a topic when it comes to latex allergy, indoor-outdoor air, environmental triggers in asthma, September Asthma Peak Week, which we are just on the brink of, you know, any of those types of things, you can always give us a call or email us or go to the online store to see all of the various resources that we have, or just simply reach out over email and we'll be happy to point you in the right direction. So as we look at our major initiatives moving forward, I just want to spend a couple of minutes on a few of the projects you've heard about. So number one, our Trusted Messengers, Not One More Life program. This is a program that actually is the grassroots, boots on the ground effort of engaging communities of color. And so we work to address the barriers for at-risk patients with chronic respiratory disease. And then we translate those learnings and barriers into data insights and personalized solutions. And that is how we then employ our digital health, telehealth program to develop self-management skills, which ultimately empower lifestyle changes and healthy behaviors through patient education. To date, we have had over 100 patients participate in that full program, and we have screened over 1,200 patients that are, again, throughout inner cities of Atlanta, Chicago, Prince George County, Maryland, and now we're headed to Houston and New Orleans. You heard earlier about the 3-day event that we held in conjunction with the Global Allergy Airways Patient Platform and the Global Food Group to hold the first annual Global Food Allergy Summit. We had over 20 internationally recognized experts, over 35 countries that participated, 1,000 people on the line, specifically speaking to families and caregivers on the latest in food allergy treatment and care. Some of our other funded projects, we talked about our CDC grant and the work that we're doing with the National Asthma Control Program through CDC and the X-Health strategies, specifically for the state programs supporting the work of CDC throughout the country. We also have hosted web resources, infographics, and webinars for those programs. Our Racial Disparities in Atopic Dermatitis program, that is the Eczema and Skin of Color web microsite and image library. If you're looking for the most comprehensive image library of eczema or atopic dermatitis and skin of color, this is the place to go. So please feel free to visit that new website. And then Linda mentioned our EOS Asthma Digital Toolkit, again with a web microsite and a number of resources to help you better understand the role that eosinophils play in certain phenotypes of asthma. So what does all this mean at the end of the day? We want you to feel like you're informed and actively involved at Allergy and Asthma Network. And so you can always reach out to us across our social channels or across email and just ask, here's my interest, how do I get involved? We've got a number of ways to connect with our volunteer manager and to have discussions around whatever areas most interest you. So now I want to spend the last 10 or 15 minutes answering your questions, and we've had a few of those already come in. And I think the first question is actually about asthma educator certification, and I'll let Sally address that one. Sally?
Thank you so much. The question was on asthma education certification, is that only available to those that have a medical degree such as nursing? Well, thanks for that question, Lisa. There are a couple of things that you need to know about the exam, and it is a pretty rigorous process that you need to be able to have 1,000 hours of asthma education to be able to sit for the exam or recertify. Now, if you can prove the 1,000 hours, then you don't have to be exactly a medical professional. But when on their website for the certification exam, these are the following licensed healthcare professionals that don't have to prove the 1,000 hours. And those are physicians, physician's assistants, nurse practitioners, nurses, and that's RN and LPN, respiratory therapists, pulmonary function technologists, pharmacists, social workers, health educators, physical therapists, and occupational therapists. But if asthma education is a part of what you do and you don't fit into those categories, you still can sit for the exam.
Great. Thank you, Sally. And again, at the network, we are honored that we do have so many certified asthma educators working on staff and dedicated to this space. We think it is an important credential that does offer additional opportunities for service in the community, in the hospital, and beyond. Now, the next question goes to Charmaine Anderson, Director of Advocacy. So, Charmaine, this person asked, what would you say is the most important legislation that you're working on at this point in time, maybe on the federal level, and then maybe a couple of things at the state level?
Particularly at the state level, most of our work, or the majority of our work, has been focused on access to care, namely out-of-pocket costs, step therapy, some telehealth, obviously surprise billing, things of those sorts, copay accumulators, a lot of more insurance barriers to care related issues. At the federal level, currently, we're in the midst of dealing with federal funding for a number of the programs that support asthma and allergy programs. And additionally, certainly the expansion of Medicaid is an issue at both the state and federal levels. And then also drug pricing. We work in coalitions with a number of groups that are really working in that drug pricing space to help our patients to be able to obviously afford their medications.
Absolutely. Thank you, Charmaine. And, under the advocacy area, we talked a lot about the legislative work at the state and federal level. We also do a good bit of regulatory work. We just hosted a patient-focused drug development meeting in food allergy and are hosting one in pediatric asthma next week. So we not only are doing legislative efforts, but also a significant amount of regulatory efforts. Now, the next question goes to Dee Gardner as our Director of Research. This person says, I've heard clinical studies are important, but how do I even go about finding out how I might participate in a study?
Thank you for the question. My answer would be to contact me. We have a number of partnerships with different companies who are looking for patients like you to participate in their clinical trials. If it fits for you, then that would be something to jump into. But definitely we have, if you look at our website for the research website, there's a place there on a drop-down menu that says get involved. And on that page are a number of tiles that have different types of studies, different types of opportunities for anyone who is interested in participating.
Yeah, and I would also suggest maybe signing up for that research newsletter, because that's a place that we collate every 2 weeks, like key things that are specific to our community. So sign up for the research newsletter. Definitely look at your monthly newsletter, e-news from the network. And then we do have a tool on our website, the Antidote tool, which helps to search through clinicaltrials.gov and better match according to specific parameters if you have interest in asthma or food allergy or any other key area. So check that tool out as well. But if you're having difficulty finding clinical studies and you really want to be involved, trust me, there is a wealth of opportunity and we are here and happy to help. Okay. The next question I think I'll take, and it's in regard to shared decision making. And the question is, how does it work? So shared decision making is really taking the historical approach of the physician in a paternalistic fashion, an authoritative fashion, saying, here's your treatment plan, go forth and do it, and expecting you to comply, right, or to be adherent, versus shared decision making is sort of flipping that on its head and rebalancing the scale to where patients and doctors share equal responsibility. They have an ongoing discussion at each and every visit about what matters most to you as the patient. And then after understanding what matters most to you and understanding your preferences, your values, presenting the viable treatment options in an unbiased way, sharing the pros and cons of each option, and then really letting you come to the best decision for you, and agreeing to support you through that decision, but then also revisiting it over time, because where we are today in our patient journey may not be where we are 6 months or a year or 6 years from now. So shared decision making is something that really is about changing the approach from I'm the doctor, do what I say do, to let's come to the best decision for you after weighing the treatment options and really basing the selection of the best option on your individual goals, preferences, and values. And again, we do have decision aids that are on our website, and you can access from allergyasthmanetwork.org to better engage in those conversations with your physician. And what I would say to you is that if you're living with, chronic conditions like allergies, asthma, or eczema, or chronic urticaria, hives, and you don't have a doctor that honors you in that way, that doesn't fully recognize your role in the shared decision-making process, then you should feel empowered to question that. You should feel empowered to perhaps even change doctors if that's what it takes. And we're here to help support you in that journey and find a physician that will come alongside you in the process of managing your disease. So, Sally, I'll ask, are there any other questions that you see at this time?
Yes, I do. One question that I thought we really should get a chance to answer is, Rosa asked, is 2016 the most updated poster for asthma medications? And Rosa, there have been so many updates since 2016, I probably couldn't even count them. We update those respiratory treatments posters probably about every 6 months. The minute there's something new on the market, we update the posters. So if you've got something that's a year or more old, then you've got something that could be updated. And again, as Tonya said, we really only charge for shipping and handling. So don't hesitate to go to our online store. There's a lot of things that are a free download, or you can order them. But keep in mind, you're not going to have to spend a lot with the network, because we want the resources in your hands. And Tonya, I didn't know if you wanted to tackle this question or not. Someone asked, what is being done concerning the skyrocketing cost of EpiPens? Many of our families can no longer afford to purchase the medication, with more children are presenting with life-threatening allergies.
Yes, so much has been done in this area, really over the last 5 years. Number one, we were one of the first companies to hold the manufacturers accountable around the skyrocketing prices. We challenged them to introduce generics, which drove the cost way down, and yet so many people still are having challenges affording them. And so we have advanced legislation to ensure that any rebates that are traditionally going back to the manufacturer or to the PBM, pharmacy benefit manager, should actually go to the patient. And so these are very complex arrangements that pharmaceutical manufacturers have with your insurance company to basically get a kickback for putting that drug on formulary. And so we have been at the forefront of making sure that there is drug price transparency, and that throughout the entire value chain, that the patient is the one who benefits from any type of arrangement like a rebate. And then secondly, the effort in just ensuring stock epinephrine in schools, in public spaces, like restaurants and sporting events and venues. We've been very active at the state level to ensure that epinephrine autoinjectors are readily available in those likely places where food would be ingested. One final thing, we just got finished advocating at FDA for new routes of administration of epinephrine. So the science is evolving. There are things that are in the pipeline, like a nasal spray epinephrine, that we are advocating for additional treatment options that would drive the cost down and increase access for those of you who are living with life-threatening allergies. Now, Sally, we've got time for maybe one or two other questions. I do see one about our patient learning pathways, and are they open and available to everyone? So highlight that resource once again for us.
Oh, no problem. With our patient learning pathways, these are developed from basic information. And so like with asthma, we've got 3 different programs. One would just be Asthma 101, and then there's asthma medications and asthma management. But these are written at a 6th grade reading level, meant to appeal to all patients and caregivers too. But it's a really good just overview. They're short videos, so we can't get super deep, but at the same time, I think that they're just a really great resource. As with so much, they're free, they're available, and you can just go right on our website. And if you even want to put in the search bar patient learning pathways, they'll pop up. And I hope you enjoy them.
Yeah. So
Tonya, one other question that we had was, are we still planning to host the U.S. Asthma Summit in person, or will it have to be virtual?
Yeah, thank you, Sally. I saw that too. So we are excited to announce that we will host the U.S. Asthma Summit in person in New Orleans. It is a smaller room, smaller space. We will also have a hybrid version for anyone who wants to attend virtually. But unless the city of New Orleans restricts that meeting, we have made the decision to move forward, as has the American College of Allergy, Asthma, and Immunology, which is our co-host for that meeting with their full Congress starting on November 5th. So we will be in New Orleans, we will be live, although a smaller community in person. We still look forward to having everyone that's interested in attending the U.S. Asthma Summit join us on November 5th.
And to sign up for that, you can go to events on our webpage and you'll find the sign up for that.
Great. So again, I just really want to thank each of you for listening in today as we looked back at the history and the impact of Allergy and Asthma Network. You know, it's rare that we stop and sort of toot our own horn, and this has been a wonderful opportunity to kind of just have that reflection, but also to take time to look forward at the exciting things that are coming for our community. Please consider joining the network by clicking on join at the top of our homepage at allergyasthmanetwork.org. We do have a free membership as well as a more robust paid membership for healthcare providers who would like to use our resources in clinic. Next, I'd like to invite you to join us for our next webinar, and that will be on Thursday, September 23rd by Dr. Linda Carrier, who will speak about asthma in the yellow zone, management and medication at 4 p.m. Eastern. As we close, I want to just thank you once again for joining us. I want to thank all of the leadership team for their work and their presentations today. I'm Tonya Winders, and on behalf of the full staff at the network, we are here to help you with your needs in caring for allergies, asthma, and related conditions. Whether you're a patient, a caregiver, or a healthcare provider, we are here so that we can all breathe better together. Please stay online and complete our evaluation survey. Thank you and have a great day.